everyone, I'm Arti and I am a PGY1 family medicine resident, and this is my reflection video for being 1 month into residency, so let's get started. When I reflect back on this month, and especially since today is my last day of block 1, I feel like I've grown as a resident in terms of being able to learn from my mistakes and, not being scared to ask for help when it's needed. And the biggest thing is being able to say that I'm unsure or that I don't know what an answer is or what something is when I'm asked by my attendings and preceptors. And I think the most difficult thing about this is that you go through medical school and you start residency and you think that I should know this and I should know how to do this and I should know how to answer these questions that I was so confidently able to answer when I was in medical school. And then you get into intern year and you're thrown all these patients and all these questions and these different scenarios, and it's like all of a sudden you feel a little less confident in being able to answer and being able to basically explain what you want to do with your patient and why you want to do it. So just the biggest thing for me is that I feel like I've grown out of my comfort zone and I've become comfortable in being able to step up and ask questions and not be scared of letting people know when I'm unsure about what I want to do and being okay with that, because I'm still in a learning process at the end of the day. So that's definitely something for me, and something that I feel like I've done well so far throughout this 1 month is just being myself when it comes to my patients. I think the biggest thing for me, since I'm in primary care, is being able to connect with my patients, and I've gotten so much good feedback from my patients when they find out that I'm a intern resident physician. And especially during my first day, I had so many patients tell me that you're doing really well, and they were encouraging, and just hearing those words meant so much to me. Now when I look back, something that I feel like I should personally work on is being a little more confident with what I want to do with my patient. So when it comes back to reporting my patient to my attendings and supervisors, I want to get to a point where I can confidently tell them what's going on with my patient and tell them what my assessment and plan is, which is something that all residents go through during residency, and it's something that you get more comfortable with as the months and years go by, but it's just something that I want to slowly start working on even more so that I'm not so clueless when I'm presenting to my attendings. A lot of times I feel like there's been moments where I will know exactly what I want to say, and the second I sit down in front of my attending, I get so anxious and scared that I kind of leave out chunks of information because I forgot it, or I will go blank on when it comes to letting them know what the plan is or what imaging I may want to get or what medications I want to switch up. So these are just some minor things that I've been trying to work on over the last week or two. Other than that, I just feel very grateful and humble that I get to be in this journey and continue my journey of medicine after, wanting to do this for so long. And it's been so exciting, and I think every day I go into work and I have this little moment where it hits me that, I'm the doctor, I can let my patient know what I think is going on and what I hopefully intend to do with them and how I want to help them.